I've got Zoe Spencer here with me today. She's a falls physio at the hospital. Hi, Zoe.
Hi, Hein.
What are the aims of the falls service?
The main aims are to provide education and training for primary care and community staff to help actively case find patients that are at increased risk of falling, and then to ensure that once those patients have been found that they're offered appropriate support and intervention. Our main aims are around preventing patients from falling and having harm from that fall and ending up in an emergency setting.
Could you share some facts with us about falls?
In Gloucestershire, we have quite a significant problem with falls. There are 33,000 falls a year in Gloucestershire for the over 65s. That was in 2014. 800 hip fractures a year in Gloucestershire, 2018. Falls are the commonest reason for an elderly person to attend emergency department, and 10% of those falls result in significant injury.
So why do falls matter so much?
Not only is there a problem with the associated risk of injury, they also destroy confidence and can lead to increased isolation and reduced independence. This then can lead to a circle of ongoing problems due to inactivity and leading to lack of muscle strength and balance.
So deconditioning?
Absolutely.
Okay.
Recurrent fallers have a high risk of death, and 50% admitted with a fall die within 12 months of the episode. It is a marker of underlying illness and frailty.
So nationally, we know that we have got an ageing population in the country, but what's happening in Gloucestershire?
Very similar, except that we do seem to have quite a significant problem within the county, and predictions are gradually increasing at quite a rate to the year 2035.
That's very interesting, but can you give us more local information, particularly mapped to primary care networks?
Yes, we can. Gloucester locality networks have quite interesting information about the population aged 65 and above and how this relates to emergency admissions for this population.
And I can see you've given us Gloucester City locality, but presumably we can get information for all the localities and their primary care networks.
Yes, we can.
So what would you like us to do?
NICE have recommended that every older person that comes into contact with a health professional should be asked whether they've had a fall in the past year. If they respond yes, they should be asked about the frequency and circumstances of the fall, and gait and balance should be assessed.
Can you talk us through the Gloucestershire Pathway from G-Care?
So on G-Care, the pathway shows that for fall screening, we need to make sure we have a real clear falls history, making sure that we're looking at current medication and offering a medication review as necessary, assessing gait and balance, looking at lying standing blood pressure, and probably doing an ECG. From that, we should be able to establish where the patient needs to be referred on to, if at all. If a patient is over 65, has had no fall but is at risk of falling, or they've had a single fall but no injury and they're generally deconditioned and have fear of falling, they need to be referred for general education and self-management, and could be given information, leaflets, and referred to a strength and balance exercise class in the community. If they've had a single fall and they have problems with gait and balance, primary care will be able to offer them the appropriate interventions in either a community setting or within core services. If a patient has had 2+ falls in the last 6 months and they have other medical problems associated, they need to be referred to the Falls Assessment and Education Service or onto a medical falls clinic, particularly if they are having unexplained falls.
Could we just refer everyone to you, Zoe?
Preferably not. There are 5 falls clinical specialists working throughout the county. We all work in each locality, and there are 4 medical falls clinics throughout the county, so referrals need to be guided to the appropriate locality.
Well, presumably if we sent everyone to you, the service would fall over because you wouldn't be able to see everyone and there'd be long waits. So what does the service do for these very high-risk people?
We offer multifactorial interventions where we would assess somebody's neurological status, mobility, strength and balance. We would look at associated risk factors such as their cognition, depression, urinary symptoms, footwear environment obviously is key, and we can offer home visit assessments to look at patients that are falling mainly in their own homes. We would look at whether there are any cardiovascular problems and whether there is any vestibular influence affecting them and causing them to fall. The key areas that we find patients have problems are with their blood pressure dropping, gait and balance and general muscle strength, and with multiple medication.
And the Med Review bit links to the great work that GPs have been doing across the county over the past few years on deprescribing, and the graph up in front of you now shows how good we have been at deprescribing for the older population. What's the evidence for the falls interventions?
There is very good evidence that strength, balance and gait training can have a huge effect on older people in preventing falls. Exercise programs really do help to motivate patients to take control of their lifestyle and to become more active. Service to other interventions that have good evidence are adaptation and modification of the home environment and providing the correct walking aids if necessary. Looking at management of postural hypertension, minimising medications that are unnecessary.